I am applicant number 21. To tell you the story of why I want to work at the VA, I have to tell you more about the most difficult meal that I ever ate. Because when I went to Haiti in 2010 after the earthquakes, I went to help a medical team set up medical clinics as a paramedic. And during that time, there were a number of women, a number of children, most of them were orphans. Many of them have lost family members, lost uncles, aunts, grandparents. Many of them had died during the earthquake. And so we set up these clinics to try to help these people get the medical attention that they needed. Well, during that time, there was a group of ladies that decided that they wanted to do something nice for us. Since we had taken our time, come from America, and were setting up these clinics, they decided that they wanted to feed us. And in the waiting room, there had been many people waiting there since about 6:30 or 7 a.m., most of them women and children. And they had to sit there and watch us as we ate these meals. And when I asked some of the people there, when I asked the missionary, when I asked some of those kids, some of the workers, I said, would it be offensive if I turned the meal down and maybe gave it to some of these orphans or to some of these people that had been waiting? They told me that it would be offensive because they had gone to the trouble of making the meal for us. And so it was the most difficult meal that I ever had to eat. It was very difficult to even swallow because of the lump in my throat. And when I came back, rather than just deciding to do nothing, I decided that I wanted to do something more long-term, that I wanted to serve others. And so I needed to make the transition from being a paramedic to a nurse, where I feel like I have more opportunities to help people. And I think as a veteran, being able to serve veterans, I think that would be one of the ways that I could serve the best. So as far as being considered for a position in the VALOR program, I think it's because the VALOR program represents excellence. And for me, I've always tried to live a life of service, live a life of excellence. And it's as far as I can remember. So even from the time that I was 7 years old, I can remember being a Cub Scout going all the way through to Boy Scouts and obtaining Eagle Scout. Even in Cub Scouts and Boy Scouts, they always instilled something in us to be excellent, live a life of service, to be excellent at everything that we did. And so even to become an Eagle Scout, there were many service projects, service things that we had to do, volunteer hours that we had to do to even become an Eagle Scout. And I tried to become an Eagle Scout at 14. The leaders wouldn't let me because they said it was too young. So I did finally become an Eagle Scout at 15. I've always tried to do it though. After becoming an Eagle Scout, I've gone through college. I've tried to do things that were still service oriented. I was a paramedic and still am a paramedic. I've been for over 20 years. And I took pride in serving people, not necessarily performing the tasks of the job, but actually serving the people. And I have a lot of nice letters from people that were really appreciative. And I think one of the things that stands out to me is that I never got a thank you letter from people that said, I really like the way that you started that IV, or I really like how you saved my husband. He was having a heart attack, but you performed everything exactly right. The kinds of letters that I got was, I want to thank you because during the entire time you were there, you talked to me, you held my hand, you let me know that everything was going to be all right. Those are the kinds of letters. And I've always been told that nobody cares how much you know until they know how much you care. And so I think as far for excellence, it's not just performing things exactly right, it's being able to keep things prioritized correctly. I think one of the biggest weaknesses that sticks out in my mind is that I tend to be overly helpful. And the reason I say that is because I work in an emergency room right now at a smaller hospital. And so I cover 30 beds. The nurses cover 4 beds for each pod, and I cover 30. And so what happens is nurses have a lot of requests. They need IVs started, 12 leads, different tasks performed, and I try to help them all. And there's no way that I can cover all 30 patients, all 30 nurses, or all the nurses that are covering those 30 people, and get everything done on time. And I think an example of that is one time I had a nurse that asked me to to do an IV. She was getting behind, and I told her that I would take care of that. And in the process, I had about 4 other IVs and a 12 lead and some other miscellaneous tasks to start. And by the time I got back around to her, she said, "Are you ready to take them upstairs? They're ready to go upstairs." And I hadn't even started the IV yet. And so the patient didn't get to go upstairs on time, which meant they had to wait longer. And it also meant that we were taking up a bed for people in the waiting room. And so I had to stop and start the IV. And the thing that I'm doing to correct that is, it sounds simple to just say that I've learned to say no. I don't really say no. I think what I've learned to do is just kind of tell the nurse, "Well, I'd be happy to do that for you, but I have a 12 lead to do. I have 4 other IVs to start. If that's going to be acceptable to you, I'll come back around and check with you." And I let them kind of make the decision of whether or not they want to say no. So I am working on it, and I have gotten better, but it's a weakness because it's the patients that kind of suffer with that. The 3 units that I would like to work at the VA would be the emergency room, the ICU, or cardiac telemetry, some type of step-down unit. And the reason I think that these would be good choices is because those types of units would play more to my strengths. My background is a paramedic for over 20 years. I work in an emergency room right now. Those are the types of things that I'm familiar with, and I think that the VA could help me develop those strengths and even become better at what I already do. And so what I try to do in my job is I try to give each and every patient a wow experience. In an emergency room, a lot of times the physicians, they get busy, the nurses get busy, a chest pain might come in, the physician may come in, order a few tests, say, "I'll be back." They don't show up for 4 or 5 hours because they're taking care of multiple people. Same thing with the nurses. They may be taking care of those 4 patients, but as soon as somebody comes in by EMS, their priority then becomes another patient. They have to take care of that abdominal pain, that stroke, or whatever it is. And when you're a patient, they don't necessarily understand that they're not the only one there. They're hurting, they're not feeling well, they're wanting to know what's going on. Some of them are frustrated, they're angry. They want to know, where did the physician go? What's the result of my tests? And so those are the kinds of things that I can help take care of. When I come in, I may ask them how they're doing, just coming by to check on you, see if you need anything. Well, where's the physician? Where's the nurse? Well, we had some chest pains come in. We had a stroke come in. They haven't forgotten about you, but these other people have to be taken care of too, and I apologize that it's kept you waiting. Is there anything that I can do for you? So they'll say, "Well, I need to know what the results were on my blood work." Well, I don't know. Let me go and let me check, and I can come back and bring that to you, but is there anything that I can do in the meantime? So a lot of times I can get them something to drink, a blanket, try to make them more comfortable, lift the head of the bed up, and turn that person that's frustrated and angry, that wants to write bad comments, a lot of times it can be turned around and they say, "This was really wonderful. The people here, they care. They were really concerned about me." And that's what I mean about turning it into a wow experience. A unit that I wouldn't want to work on, I think that it would be an honor to work on any unit, but if I had to choose one, it would probably be med-surg. And the only reason I say that is because I think that in med-surg, typically there's a higher patient-to-nurse ratio. And so you tend to get spread a little bit thin and don't necessarily have the quality time with patients that you would normally get, even say in an emergency room. As crazy as that sounds, as busy as it gets. Just as an example, one of the stories that I've heard is from veterans. I got to talk to one veteran in the emergency room who had gotten a flying cross for landing a B-52 bomber in World War II without hydraulics. I got to talk to another one that was a photographer during World War II, and he told me what it was like to go to different parts of the world and film some of the men that were fighting during the battle. And so working in an area where I'm spread kind of thin may not give me the time that I need to be able to kind of play more towards my strengths. Like I said, I can work anywhere, willing to go anywhere that I'm needed.